So good morning, everyone. Welcome to another webinar from the OPS family, Operationalizing Peer Support. My name is Shelly Shore, and I'm the Operationalizing Peer Support Program Manager. I'm extremely happy and excited to have our guests today. We have Annette and Javan Jones from Jones Community Solutions. I am opening my Outlook because I want to share and read their bios to you, letting everyone come in and feel comfortable. Let me see. Okay. I'm sorry about this delay. Okay. So, where am I? Sorry about that. Okay. So we'll start with Annette. Annette is, I'll read that to you. She's the CFO of Jones Community Solutions, a for-profit, peer-run social services enterprise and founder of Community Life, a virtual community drop-in center focused on mental health recovery and wellness. Annette has found her voice working as a change agent with services and organizations in the community that are already doing great work. She can be found partnering with individuals and organizations to eliminate stigma and challenge discrimination by providing all-inclusive community events, educational workshops and seminars, and trainings to the community at large. And she can tell you more about this in a few minutes. Javan Jones is the proud owner of Jones Community Solutions, a social services enterprise focused on access to equitable and inclusive social services in all communities. He is a crisis prevention and intervention instructor, a certified peer counselor and a trainer, a peer group facilitator, and a consultant for social services organizations across Washington state. He is certified in mental health first aid, a first responder for King County Search and Rescue, an incident commander for the Community Emergency Response Team in Des Moines, Washington. Javan is a passionate legislative advocate and was present for the signing of the True Blood bill with Governor Ainsley. His lived experience is vast, and his formal education consists on degrees in econometrics and laws and ethics of business. Javan was the Washington State First Peero Award recipient in 2020 and is recognized as a valued community leader. And I believe Annette was the recipient of the same award in 2022. I hope I'm right.
Cindy Wiley.
Yes, yes. So with that said, I will turn to my guest and have you present and speak to us. And thank you for being here.
Thank you. Thanks for having us.
Thanks
Javan,
for
you
having
want
us.
to kick it off?
Well, thanks for having us. It's our honor, and it's a pleasure. It's also a blessing. So, where would you like to start?
So I know you are running a peer-run organization, and I think everyone is a little curious about that. How do you start? Why would you start a peer-run organization at all? And how is it different from any other organization, maybe?
Okay. We started our organization because we were already doing the work. So we were already providing services to the communities at large, but it wasn't under Jones Community Solutions. It wasn't under peer certification. We moved here from California, and when I had a clothing company and a property management company at the same time. My wife was doing real estate. So when we came here, we were starting over, and we were volunteering our time. I was volunteering my time at Habitat for Humanity, and she was volunteering her time at like the food things. We realized that we could help other people while we were needing help as well. So yeah, my kids, they got everything going on. So we decided that we would get other people knew that we were doing this work, and they would come to see us, and they said, this is peer work, you know. So we got certified. We were blessed to get into a training, and we just started taking it from there. We had opportunities that led us to become who we are now. It was just, we were being offered opportunities for the work that we were already doing.
Mhm. And so what are you doing? Can you tell us a little bit about Jones Community Solutions?
Jeez, we're doing a lot. We're contracted. We have several contracts right now. We have one that we are providing certified peer counselor trainings statewide with Washington State Healthcare Authority. We're contracted to provide a community diversion program, jail health services with King County, City Seattle Public Health. And that's a partnership through the executive office and the prosecuting attorney's office to divert first-time felons, adults, 18 and over, first-time felons, to they get engaged with community services that, well, social networking and organizations like us get engaged. Those felons can come off of their record, and it gives them, you know, a felony the first time is big, it's life-changing. So most of the reason that they're diverting those is because these new charges, like 29 of these charges are basically crimes of poverty. So we're addressing that need on a behavioral health level, on a recovery level, instead of an authoritative punitive level. We also are expanding peer support. We are contracting, I forgot about that. We're expanding peer support. We're doing a lot of very creative partnerships. You know, we're working with police departments and colleges. We're doing things that's not the norm in the peer world, but we're like expanding it. We always work outside the box. We always try to find a niche. We always try to fill in the gaps. We're always trying to bridge the gaps. We're always trying to make connections. So we're just trying to stay as dynamic as possible. We have other service agreements with other organizations that we do provide trainings for them as well. And we're mentoring individuals as well to bring more BIPOC individuals on to become more providers instead of just consumers in behavioral health.
That's a lot. That is a lot of work that you're doing. Annette, anything that you want to add to that?
As he's been talking, I've been thinking about how we complement each other. I think that was one of the questions we were posed. And connection, I think, is really where I lie. So when he touches on things, I think of the connection of it. So mentoring, for example, we've created a mentor hub on Tuesdays from 1 to 3, where we're trying to connect mentors to mentees and educate everybody on the process of becoming a trainer, a CPC trainer in Washington State. A lot of the work that he's presented that we're doing now, we also did the work to even have that be an opportunity. The jail health services would be a good example of that. And even our CPC trainings are a BIPOC CPC training. And so, like you said, we think outside the box. So usually a lot of what we are doing, it's fair for you to ask, what's the twist? Because there's always something maybe a little bit more or a little bit different, or something. I guess we lead with being a peer. And so we sort of get our foot in the door all over the place. And even when he was talking about our early start, someone talked about the fact that all the work we were doing was peer support, and perhaps we could get funded for it because a lot of the services we were providing were free. We just saw the need, and that's where we got in and participated. And so when someone said there's funding for it, What he didn't include was that if you work in a Medicaid reimbursable environment, that's not where I was working. That's not where Javan was working. That's not where we had intended to work. That wasn't our vision. And so when we got certified and understood that's really what the opportunity was at the time, we started exploring outside of the box, and we realized that collaborations is really where our niche is, and collaborating with other organizations, individuals, everybody that's already doing the work. And we were able to get in there and show them how and why we complement what they're doing, which is really what peer support is about, showing people how and why we complement the services that are being provided anywhere they're being provided. So yeah, so what Javan said, and then with a twist.
Right, absolutely. No, I get it. And I think that's a good point that you mentioned, when you are providing peer services in a Medicaid reimbursed environment, it's not the same as providing peer services in other places. There are a lot of similarities, because peer services to me are peer services. But not everyone feels comfortable in this or that environment. And for you to choose your own environment that feels comfortable and right for you, that's the way to go. And so I feel like when you're not in a Medicaid reimbursed environment, you need to be maybe a little bit more creative to get your fundings, to get your contracts. It's a constant work. Can you talk to that about a little bit about that?
It's exhausting, because if you're not a nonprofit organization, there's no pass for, we haven't done that before, is what the response. We don't do that. It's not done that way. You have to do it a certain way, but you don't have to be a nonprofit organization to provide the services. Mm-hmm. Just receiving funding is very hard to do. We have to basically educate everyone we meet on what we do every time, all day. We're qualifying ourselves to everyone we come across, which is very exhausting. And not only do we have to educate them, we have to have proof of concept before anyone would even consider contracting with us. We have to basically do all of this work for free, prove ourselves, and then hope someone will say, let's talk about it. Let's sit down and meet. And then we have to see, it just takes I'll talk to my boss, and I'll talk to it's just so exhausting that we just want to provide the services. So we have to be very creative when we come with proposals, proof of concept, and education with everyone we meet every day, every time we go across. I've had 5 meetings with one police department and 5 different people in 1 month, telling them the same thing. And I just finished my 5th meeting yesterday, still waiting for a response. But that's the type of intentional peer support that we have to have. There's no one out there being intentional to provide the support to our communities. And I can vouch for that myself, because I know what community I'm from, and I know what's available, and none of this is available there. And there's no one else reaching back to these communities to say, hey, this is how you can be healthier. This is how you can better yourself. Here's some educational opportunities. We can help your community. It's not that. So for us to be the ones to go out, make the partnerships, make the connections, educate. It's not just educating other organizations and other, let's say, leaders and gatekeepers, what you say. We have to constantly convince them that we're good enough. Mm-hmm. And that's tough. It's really tough to be, well, I'm more educated than most of these other people. My wife and I are very educated, and we're only successful because of our perseverance, not our education, and not our friends or partnerships, not our resume. It's our perseverance. And it's us constantly educating and trying to be creative and offering different types of proposals on how we can earn a living providing the services, we have to basically come out and tell people, we know you got a budget. And we have to convince them how effective we can be and how we can better them before they will even consider a meeting. It's tough. It's really hard to do. But like I said, we're only, I guess, this much successful because of our perseverance, not our education and not our friendships.
Mm-hmm. Yes, and I think about, that little bit of conflict when we talk about peer services. Peer services are very humble in a way, right? I mean, I'm not talking about my education, I'm talking about my life experience, and that's the powerful part of my support to you. With that said, we can't just stay humble, right? Because peer support is a young profession, and we want to make it, part of the discussion. We want to sit next to the table, and so we can't just stay humble. So we add passion, right? We add conviction, we add determination, and sometimes you feel like there's a conflict. Like, well, we talked about that, Javan and Annette, about like knowing your value. And Amanda talked about that in another webinar, knowing your value and demanding a seat at the table and demanding to be paid in a way that will show your worth, right? And even, when I talk to billing people in the healthcare authority, they talk about contracting with MCOs. I know you don't do that, but when you do contract with MCOs for the peer codes, aim high. Get those higher rates for peer services, because that's how we start, being part of the conversation, having that seat at the table. So how hard it is it for you, to come with your passion and your humility, but also say, hey, I deserve to get this. We need this. We are part of this, conversation.
That's a good question.
So, yeah.
Sorry to cut in. It's the work. We do good work and we believe in it. And excuse me, and believing in the peer support principles and using the skills that we teach and we learned. I was just talking, I think, to one of our colleagues yesterday about our worth, and that it's gotten easier to do that over time because we learn to speak and to be strength-based. And so it's not that I don't have negative things about me and things that I need to work on. It's just that I'm able to also talk about the things that are good about me, and the work that I do speaks for itself, and the same for Javan. And anyone that does peer support work and does it well, it speaks for itself. And so it's not a matter of proving ourselves for me as much anymore as it is giving people the opportunity to get to know us and the work that we do, because we've always been transparent. We've always invited people to come along on a work day with us and just see what that's like and see and hang out. And that's really the best way to get an idea of the work we do and how we do it. It's not really, again, it's peer support is peer support across the board, but how you apply it and how you use it, that's a very special and unique thing to every peer. And as well as, Javan and I, and we acknowledge that, know that, and use that.
Javan, feel free to add anything if you want to.
I was gonna say, it's important. We usually, in other organizations and directors would come and just sit in our office and watch us work a lot of times. And it came to a point where I would be like, you didn't have to tell us what to do, just come and watch what we do. And they learn more. It's just, I just think that in different, so in Washington State, the peer support movement was like going in a specific direction. It was just like really, it was really linear, to be honest with you. And we kind of redirected a little bit and add some flair and some color into it. to the best way to say it. We are doing things differently because the communities that we reach out to intentionally, they receive things differently and they deliver things differently. So you have to be able to have some type of dynamic abilities to be changing constantly and working with different individuals in different spaces to be more welcoming and receiving at the same time. And we have a disposition about us that we can accept things differently, and other people accept us differently as well. And we're not trying to take away or change anything. We're just trying to capitalize on what we're good at. And we know, like you said, we know our worth, we know how good we are and what we're able to provide. So instead of us always trying to be exhausted and convince people, we know exactly who we can reach and how we can be successful. And that's where our focus is.
Mm-hmm. And does it get easier in time? Because once you work with some agencies, some organizations, you can kind of add that to your resume, so to speak. And is it easier to convince other places to work with you?
It is, but that was even more exhausting because we didn't just get to meet everybody. We didn't just get to, all these executives and directors didn't just pick their phone up and decide to call us. I literally took jobs at major organizations to meet individuals, to show how good I work, while still running our own business full time. So we can, we were like working on outside of their businesses, we were working in the businesses with them, we were trying to meet with them, we were on every board that we can get in. We were really implementing ourselves in every avenue possible just so we can be noticed. Mm-hmm. We were proving ourselves for our, so-called resume. It gets easier. It's easier now because we stand out because of the different things that we do. It's not the norm. We really stand out on the things that we do. And it is easier, but the harder part is now you get watched more, I guess, you know what I mean? Like you feel like you're under a microscope more now. Uh-huh. It's like, okay, I fought so hard to get to be equal. Now I feel unequal again because now I feel like everybody else is just watching me. It kind of feels like they're waiting for me to make a mistake or something. But that's why I say I just focus on what I know I'm good at and I can succeed. I just don't think that in our business, in our field, that there's room for competition. I just always think that there's room for growth and learning opportunities from each other. So I just try to partner with as much as possible, as many organizations as possible, and share our services. I mean, it gets easier as long as we're building relationships.
Right.
Sorry to interrupt, but there is a question. I don't know if you saw the hand up.
Yeah. I saw. We'll get there. And I know, Josh, your hand is raised.
Yep. I'll totally wait. Yeah, keep killing it.
No, go ahead. How about you ask your question now?
Oh, okay. Well, earlier Shelly mentioned like how we should not stay humble with the dope work that we're doing, right? How we should display our conviction and determination, right? And I would offer, like, there's a huge piece that I think that we miss in these spaces because of us being humble. That's us, we're humble, right? But it's the packaging of the message. We have the message, we deliver the message every day, but the packaging of it, and how do we share the message in culturally appropriate ways? Like, how do we build a staff buy-in directed promotion? And how do we build a peer-centered promotion stream? And why are those keys to any agency, right? So your presence is your proof. And I heard Annette mention they give people opportunity to get to know you. And I would offer like that marketing and promotion and the packaging of that message. So you just do it that one time, boom, boom, we're Jones Community Solutions. And then that can speak for you volumes. And I only like want to add that in. Is that something that you guys have like discussed or mulled over or thought about bringing into the process? Because if it exists online, it exists in people's phones, and they get to know you while you're actually doing the work, is that something that you guys have tapped into or would consider?
If I'm understanding your question, it's why don't we do more marketing and really tap into social media and all of
Well,
that?
not really. Why don't you? I just feel like because of the work that we do, it's not something we focus on, right? It's not something that we shine the light on, and I think it's a really important part of what we do. So not really why don't you, but would you be open to consider possibly doing things like that?
So yes, my, I don't know if Javan is my right brain or left brain, but Javan is the one that is really into all of that. And so I'll let him speak in 1 second, if that's okay. For me, I shy away from all of that because I'm working with people in vulnerable situations.
Mhm.
And I don't, the humility for me is not saying, hey, look at, I was out on the street corner and I gave
Absolutely.
5 people money today. And there's a video of me doing it and all of that. That's not,
Absolutely.
in that kind of situation, I wouldn't want to be part of, if I was receiving the service, I would not want to be a part of that, that video.
For sure.
I work really hard to help or to help maintain the dignity of the people that I work with. And I find that a lot of times advertising myself would take away the dignity of the people that I work with.
Come on.
And that's just not
Absolutely.
something I'm willing to compromise on.
Let's go.
But
So,
we do it. I mean, there's,
yeah, what I do is, so for me as a business developer, as a CEO, I have to make sure that my business stays afloat. And I don't do one thing and say, hey, we did it and then move on. I have to do executive work. I have to do marketing. I have to do a lot of things that don't have anything to do with peer support. So I'm out there getting contracts and licenses and marketing materials and developing a lot of different programming that maybe you haven't seen yet or maybe don't know about. We have a whole YouTube channel where we have interviews where
Come
I
on.
interview community leaders. I have it's called Community Talks with Community Leaders. And maybe people don't know that, but you do now. We have like the virtual drop-in. We have peers on peers where we take people out to camping, fishing trip, hiking trips. We're out in the community. We advertise a lot of things, but like Annette said, we don't really like putting faces on, trying to be, our humility. I think I have to stay humble because I just feel that we're just lucky to be where we are. We're blessed, and with some luck. And, you know, like I said, we're not here because we got this good education and we didn't get here because of opportunity. We got here from struggling. So I have to stay humble. So when I'm advertising and marketing like that, I'm trying to do it in a way to where it's not like Annette said, hey, I gave 5 people $1 today. Ta-da! I don't need your likes for that. If you wanna support us, you can come hang out with us, you can donate to us, whatever. I don't feel that I have to always show everybody what we're doing. But the thing is that we have a lot going on and a lot of people know about things here and there. Because here I go once again, educating everyone about what we do and qualifying myself about the things that we do, our capabilities and how we operate. And I spend more time doing that every day.
And that can be harmful to you in the work you're doing, right?
Well, it can, but I have an understanding that this is how I develop. And
Sure.
it's nothing wrong with someone asking questions because I didn't get here keeping my mouth shut. And so when people always want to know what it is, you know what, it kind of makes me, it just refines me over and over of how to express myself and how to describe my business. And as my business continues to grow, I need to be able to continue to refine and redeliver how we are and what we're doing now. Because this time last year, I wasn't operating peers on peers. This time before COVID, we didn't have the drop-in center, you know, community life. We didn't have that. So within the last 2 or 3 years, I have 5 more programs and 3 new contracts. So me expressing and then educating individuals constantly, that's fine. Because you know what, I get to a point to where I can start saying I'm proud of myself. I haven't done that in my life. I'll be 50 years old, and I can probably say I've said that about myself 3 times, and it's probably been within the last year or 2.
There we go. Let's do it.
But I would like to say that's you brought up a good question, Joshua, and I believe that really is the difference between growth and non-growth, is embracing and figuring out how to embrace the marketing that needs to happen in ways other than word of mouth, like Raul put in the chat box. Yes, it's very much been word of mouth. And we still rely on word of mouth, because really that is our qualifying. When someone else speaks about it and they have whatever standing they have in the community or influence they have in the community, and like yourself, Joshua, when you speak about us, that carries weight. That carries
Right.
a weight that we can't carry. I can say I'm great all the time, but if I don't have other people buying in and agreeing with that, then it's just me saying I'm great all the time.
Yeah.
So what
it's
if
just
what if our commercial was other leaders like myself and Shelly and Jackie and everyone in the room talking about Javan Jones and Annette Jones and the Jones Community Solutions and our
That's the-
interaction?
that's the best marketing material available. That's why I don't mind constantly educating. It's not like I'm saying someone is not smart or dumb, or I'm just letting you know about us. And also the best part about that is the one of the key principles of peer support. The peers that we work with, they get to see that we're modeling peer support. They get to see all of the self-advocacy that we're doing. It's a lot of things involved in what we're doing, that we're basically living it every day, and we're walking the walk, and we're talking the talk, but we're also letting others see what it takes. I mean, you can succeed, or you can be healthier, or you can have a better day tomorrow, because everybody has the right to have a bad day. Everybody has the right to have a lived experience in their life, and everybody has the right to move forward. And we're giving them that. We're modeling that. We're showing them what it takes. We're showing them perseverance, resiliency, self-advocacy, everything across the board. And we're also not stopping.
Sure.
At least,
Well, let's connect more about it later. I didn't mean to tear us on that tangent, guys, but it's a super important part of access and dissemination of information. Like, how is the message being delivered to the people that I serve, right? And how will it end up in their phone so they know about it? And access. So I think about, like, what is our community watching, listening to? How are they engaging with the things that they're engaging with? And same with our staff. And how do we get staff buy-in? Because it's not the same stuff, So yeah, we'll connect.
Thank you for the question.
Absolutely.
Thanks, Josh. And if anyone has a question, you can either write it in the chat or raise your hand, and we'll get to you. There's so much to talk about. I'm so excited about that. Annette, you put something in the chat, community talks with community leaders. Do you want to say what that is?
That's Javan's baby.
That's some interviews. I do interviews with leaders in the community, other executives. I've interviewed individuals running for office. You want to hear their story. You want to hear, I've interviewed different types of peers and family partners, forensic peers, executives, just giving perspective on how the peer community operates. And it's not just in the state. I interview people everywhere. I'm gonna start having individuals interview us. We do a lot of different things. That's just somewhere that individuals can go and just watch. We're going to put trainings on there, some trainings as well, just to put out there. We do a lot of different things in a lot of different ways to put our reach. Like I said, that word of mouth marketing is the best way. If we don't have other people buying in and say, oh yeah, I saw their videos, their interviews, they're great. Oh, I went to a webinar. They really know what they're talking about. Oh, they trained me. I passed. I've got a good job now. Or, hey, they showed up at a crisis. Their prevention and intervention techniques were outstanding. I do legislative and forensic work. I'm on a defense team. I'm a mitigation specialist. I write bills. I do a lot of different things on the other ends of the stick where in the middle to me would be direct to consumer services, and I have to make sure those needs are met. And it's not just by, holding someone's hand. I have to do a lot of things legislatively. I have to show up in the courtrooms. I have to do a lot, and it takes a lot. But I don't compromise when it comes to my intentional peer support. I work with anyone, everyone, everywhere, anytime. Crisis doesn't take a break. So you always need someone, and I'll always be there. That's just how I feel.
Absolutely. Must be nice to, I mean, marketing is hard. I don't like doing that, but it must be nice to market something so helpful, so healthy, so, positive. It's not like, I don't want to say Pepsi, but it's like you're marketing something that you believe in. This is your passion. This is your life. So when I said, earlier, is it getting easier? I didn't say it's easy, just easier. And that's kind of, I want to encourage other people in the community to do what you do, even though it's so hard. It is so demanding, but we need more people like you. We need more of that commitment. So I was trying to stay positive,
Oh, it's very positive. It's nothing wrong. It's just, success is an uphill battle. Nothing's easy in life, and if you want to try hard, you can. And sometimes when you can't, you might need a hand up. We don't have a problem asking for help. We don't have a problem telling someone, yo, that was hard. But, there's some easy times too. We can talk about how fun it is. The best part about what we do is that we love to do it. I always feel if people can find their God-given talent, then they'll always succeed. And apparently, ours is humanity and advocacy. That's just all it is to it. We provide support. I don't want to change you. I just want to support you.
That's fantastic. So I have a couple more questions that I think other people would like to hear some answers. First off, you work with peers. You're a peer-run, peer-led organization. Can you talk a little bit about supervising other peers and working with other peers in your organization, within your organization?
Well, that's tough because working with peers is a lot easier than supervising peers. Working with them is fine because you all have the lived experience. You are fighting the same fight, you all working together, supporting each other, usually in teams. But supervising peers is a bit more demanding. It's not just supervision. We're developing these individuals at the same time. We're supporting them. We're working with them through their recoveries. I have more of, it's just really important for me. I have to worry about my team. It's like when it's just me or it's just us, we can go, but I'm trying to support my family. But now as a supervisor, as I'm running my business, and I have like 10 people on the team that we work with, right? Now they are, now I'm responsible for them. I feel I have a responsibility for them and their family, because everyone that I work with or I supervise, they have a family, they have rent, they have a car, they have kids, they have something. And employment is key to keeping that going. Being not just a supervisor, but we're business owners, so we pay these individuals. So that takes on a whole nother level of responsibility that I have to be very careful of how I support my team. I want to make sure that they're paid fairly, that they're supported correctly. And as a supervisor, I do more advocating for my team. I was talking about this earlier with Annette, and it's like I have to be in front of them, my peers that I supervise, and I have to come from the back end as well, because it's like I have to kind of get things smoothed out for them wherever we go. We're introducing, we're meeting individuals, we're going to other organizations, we're providing support. I'm usually like the first point of contact. So I'm introducing them to the organization, to our program, to our team, or whatever. Our peers work with them. I'm on the back end once again. How did that go for you? Were you triggered, traumatized? Did anybody mistreat you, or are you happy? I do a lot of follow-up. I just do a lot of care about the individuals that I supervise, because peer supporters weren't really welcomed in the field, in the health community at first, and they still have bump heads with clinicians a lot when they're agency affiliated. So it's kind of hard to have your voice at the table. So I don't know, I do a lot more supporting the peers I supervise than the colleagues I worked with when I worked in the fields and agencies or partner with them, because you just share a lived experience or your partnership or win this together type deal. Supervising, I have to really, really make sure I take care of my team. They come first. I have to make sure that my team is healthy. I make sure they get a lot of self-care. I try to make sure that they're supported and everything, like holistically, not just on the clock.
What we were talking about this earlier, and what we really came to is that we're able to put recovery at the forefront of the work that we do, not only for ourselves, but for our team. And that means that we are checking in on their recovery and supporting them in what they feel they need to do about, to, and for their recovery. And a lot of the early work I did, I was able to talk to executives in peer-run organizations and just mental health organizations and all of that. And one of the things that I was discussing or found was that once you became a peer supporter, there wasn't a lot of peer support offered to you or for you, or it was difficult for you to find peer support for a lot of different reasons. And so it's been important for us to make sure that peer support is available and provided to everyone that we work with, because becoming a CPC, you're still, you're still in recovery. You still need to take care of yourself. And oftentimes you're put back in the same situation, and you find yourself working in a situation, where your lived experience happened. And that can become, challenging and dicey. And if you don't have peer support to go through that, or supervision to go through that, it can be very challenging. And I see that's where a lot of us tend to fall off or relapse, and then not have the support to either stay employed or come back. So for us, it's really important that we support anyone that works with us. We both try to just provide peer support to everyone across the board, and model what that looks like to both give and receive it.
Absolutely. And your answers truly embody, everything that I talk about when I talk about supervising peers. There's a lot of modeling going on, right? There's a lot of, walking the walk, not just talking the talk. There's a lot of strength-based elements and self-care, and also everything needs to be recovery oriented. And so I think that, modeling goes with everything, with supervising anyone, with being parents, with being, good friends. But definitely with peer supervision, you want to do a lot of that. And this is, you care about that, you feel it, you've been there, you are a peer to your peers, to your supervisees. You're still a peer to them in a way, in many ways. And so you definitely said it, exactly how we want to see it. I also think that, there's a learning curve for everything. And so you learn, and as you go, what works, what doesn't work, and go with that. I know we have about 15 minutes, so I want to open, this discussion and see if anyone wants to ask a question. I sure have more questions for you, but I want to give others opportunity to ask you as well. If you want to write it in the chat or just raise your hand, we'll give you an opportunity to ask a question. And then in the meanwhile, maybe you can tell me a little bit, or tell us a little bit about the BIPOC trainings that you're doing right now, and how is that going? And maybe you can tell us a little bit about that. BIPOC CPC trainings, I should say.
You want to take that, Javan, or you want me to?
Go
Going
ahead.
amazing. You said me? It's going amazing. This has been a really phenomenal opportunity for us, for the groups that are coming together, working with HCA to make this happen. All of it has been amazing. We just completed our 6th training, and seeing who comes to the table, whether it's virtual or in person. We've had one in-person training. It's been amazing, and much like almost everything that we do, it's the experience. It's not something that you can, I mean, yeah, you can walk away from it talking about, I learned a lot of things, but more than that, it's the experience and the feeling behind everything. And I'm really pleased that we've been able to bring that virtually as well as in person. Having done the in-person, I now understand the differences and can put my finger more on a bit what's lacking, but I do know that virtually it's still coming across. We're still being able to have those great but difficult conversations that need to happen in a multicultural setting. And there are quite a few more CPCs, BIPOC CPCs becoming CPCs, getting certified and passing the test. And I believe that a lot of that has to do with the work that Javan and I are doing. The other thing that I would like to point out, something that we are working on is just more men in the peer support movement at all, let alone Black men. But I can definitely tell you that there is a difference when Javan presents. Javan does some of the modules versus when me as a woman does it. There's that need for connection. There's that need for male bonding. There's that need for men to see other men in this environment. And so maybe I'm a little biased. I'm a fan of Javan, but I'm really a fan of Javan for showing up and participating and providing this service, just so that, he's a great trainer too, but just him being there and representing, just being a man and showing up in this industry, it means so much. And I know that he's inspired so many, and there have been so many men that have now come through the training, and I'm really proud of that. I'm really proud to see that we're doing the work that needs to be done to help everybody feel comfortable and like they have a place at the table. And I think that this training is really doing that. And a shout out to Amanda, because I have gone to her on more than one occasion for supervision. I mean, she holds my contract. I know she's not technically my supervisor, but it's the same concept, going to her when I need some consultation and to know that the steps I'm taking, they seem right by somebody else's brain too. And that's really, and being able to, reach out on a dime and just toss something her way and say, hey, this is what's happening. This is how I'm handling it. Any suggestions? That's been really critical too. So again, I go back to those collaborations and the partnerships that we've built our business and our community on. Those are very important to us as well.
Absolutely.
As far as the BIPOC trainings though, it's multicultural. We have everybody there. I think what you want to take from that is that the trainers are BIPOC, and we get a different delivery and a different way that we train is different. And it's nothing wrong with it, because we've had a very good success rate with the classes, with the passing scores from our trainings. So we're doing something right. We're doing really good actually with that. And we're doing really good with our passing rates. When the CPCs are coming out our trainings, we've done maybe like 5 or 6, and they're statewide. We got some good peers out there now, and I'm proud of that.
Yeah, and I remember our conversations about representation, and I think Javan, you were saying we need more men, we need more trainers, because that's the connection that you need in those trainings. And so just want to say, Annette was talking about Amanda, that would be our Amanda Foley, our peer program administrator. We work together, and this is what we do, right? The peer work is through all the stages of the peer work and all the parallel processes. So that is wonderful. And the peer, the BIPOC CPC training is part of our BIPOC provisos that we have at the state to enhance representation and diversity in the workforce of peers. So just to clarify that. There was a question in the chat. I'll just read it out loud. So Ankur was asking, what model of peer development are you using? Does it and will it change and evolve as you grow?
What model of peer development am I using? I am using, I guess I would say, intentional peer support.
Mm-hmm.
And does it and will it change and evolve as you grow? Definitely. Every day we grow and we evolve, and we look forward to doing so. I look to evolve. I look to meet new people. I look to find new ways to deliver programming and resources. I want to learn more as much as possible so I can provide a better resource to the communities.
Absolutely. Thank you. Any more questions for Annette or Javan? So there was a question about signing up for the peer-to-peer newsletter. Amanda was providing the link for that, and you can read about Jones Community Solutions in, I'm not sure if it was the December newsletter or November, but you can actually access all the former newsletters on the HCA Peer webpage. Everything is there right now. We're very excited to have those newsletters. Thank you, Amanda. So we have about 5 minutes. I will give you the stage, Annette and Javan, to just say whatever you feel like you need to say for our audience before you head out.
I'm gonna
Keep
say,
going.
yeah, I'm gonna say thank you for having us. We're just gonna continue to work hard and evolve. I'm gonna put my phone number and email in the chat box. So if anyone would like to reach out to us, partner with us, figure out how we can work together or what we can do. I've received a couple emails already, so I'll be following up and reaching back to those individuals. So please get to know us. There's a message in the chat from Cecilia. She is our executive assistant. She put in a link for a link tree. It has a lot of all of our programming on there and all of the links to it if you went into that link tree. Maybe Cecilia can put it in one more time, and then we'll be happy to reach out and get to know you more.
Here I see it. I can also post it again. I'll put it again in the chat. And once we're done, I usually send a follow-up email. We are recording this, so I will send everyone that was here today the recording, and you can get all the links and all the resources that you've seen in the chat. I wanted to use this stage to thank you immensely for being here today. You are such wonderful partners and an asset in the community. I wish everyone would know you, and that's the reason why I wanted you to be here today, because you're doing so many things. You are making the peer community proud and just making our community healthier and, thriving. So I want you to keep doing what you're doing, even though it's hard. And hope to see you everywhere and again.
Thank you,
Any-
Shelley. We hope
yeah.
the same.
Yes, I'm sure everyone feels the same. Thank you all. I will advertise the next webinar and everything that we're going to do next month. Stay tuned, and thank you for being here, everyone.
Have a good day, you all. Love you all. Take care.
Everyone. Bye.
Have a good